Good morning and welcome to Western New York at Work, your business-friendly conversation, where each and every Saturday we talk to business leaders and professionals about the issues and concerns affecting our community. And today we have an exciting panel discussion in store for you. Good morning, Buffalo, and welcome to Western New York at Work, your business-friendly conversation, where we talk about the pulse of what's happening in our community. And today we have an exciting conversation in store for you today. So without further ado, I'd like to introduce our panel. We're going to start with Ebony. Ebony, welcome to today's show.
Thank you. Thank you for having me. I am Ebony White. I am the Community Health Outreach Coordinator with the African American Health Equity Task Force. So I'm a native of Buffalo, New York. I've spent probably at least 10 years in doing this work because I understand my community, because I'm a part of my community. I'm not the only voice of my community, but I do everything I possibly can to communicate the needs, the barriers, and along with any health disparities that impact them.
We also have the distinguished Reverend Kizer MPointer.
Well, thank you, Dale. Thank you for the invitation. Thank you for tolerating my presence here.
So tell us a little bit about the type of work that you do.
I'm generally a rabble-rouser all across this community. My concern is how do we get our people to a place of good health, and what do we need to dismantle? And then what do we need to build so that not only is that a possibility, but that becomes the norm for this community.
We also have another distinguished member, Dr. Raul Vasquez.
Hey, thanks for having me. So, I represent a couple of different entities, Urban Family Practice. We have two practices on the east side and the west side. And then also GBON, which does a lot of care coordination. And the last thing is an accountable care organization. So 250 physician networks, and we pretty much span the area of Buffalo.
Okay, fantastic. Well, it sounds like each and every one of you can have your own individual show, but I'm glad I was able to bring it all together. In fact, the guy who brought it together is Stan Martin.
How you doing, Dale? Good evening, everyone. Dale, thank you for the invite. Pleasure to be here this evening. For those of you who I haven't had the pleasure of meeting, I'm Stan the Man Martin. I am the project director of Hope Buffalo, as well as our REACH initiative. And as Pastor Pointer mentioned, our goal and focus is to address health equities and disparities amongst African Americans and the Latinx communities here in the city of Buffalo. And I look forward to our conversation this evening. Thank you so much.
Thank you as well. And let's face it, everyone, healthcare is not only an economic engine in this community, but it's also a public safety concern. And that being said, let's start with the REACH program and as it relates to flu vaccination. And Stan, I'll start with you.
Thank you, Dale. Yes, REACH is actually an acronym. It stands for Racial and Ethnic Approaches Towards Community Health. It's actually under our organization, which is called Chickatelli Associates, or CAI. We are one of 31 grantees from across the U.S. that are working to increase awareness and education, especially this year, surrounding the importance of getting your flu shot, in terms of getting vaccinated. The initiative itself, as I mentioned, we're one of 31 organizations across 22 states addressing 12 different populations. In particular, we're looking, to address the health disparities amongst, as I said earlier, African Americans and the Latinx community here in Buffalo, because we know that they're disproportionately, impacted by influenza.
Okay, and Dr. Vazquez, if you could kind of pick off where Stan left off that, because with your various entities, I'm pretty sure this hits the heart, really hits at home with the type of services you provide to the community.
Well, I think, there's the sad thing is that certain zip codes don't have access to primary care. And so that's always been a big issue. And I think with the chronic diseases, the fact that these vaccinations are not being given could be a major problem, especially this year, because the flu and the COVID are really similar. And I think it's real important for us to start with vaccinations, becoming a little bit more aware of these things in our community. I think there's a lot of mistrust. There's a lot of mistrust for the Department of Health and hospitals because our communities have always been sort of very hesitant because of history. And I think we can probably bridge that. And I think it's real important to have that sort of translation take place. Health literacy is a major problem in our communities. And the better we inform people, I think the better they're going to be to take these shots. And I, like the flu shot, me and my family take it. So it's not something I'm going to recommend if we're not willing to do it ourselves.
Is this year more important than any previous years, in your opinion? Dr. Vazquez.
Yeah, absolutely. If you get a vaccination, the chance of you catching the flu is very small. And if you do get it, it's a mild form. If you get the flu, remember, we still have about 45 to 65,000 people that die each year. And so it's just the awareness of vaccinations are so important. And not only just the flu, but there are pneumococcal vaccines, shingles vaccines, things that really do help prevent you from getting the disease. Because once you have it, the complications go up. And we have multiple different types of vaccines. And unfortunately, because of COVID this year, kids aren't getting vaccinated on time. So we will see a rise in measles, mumps, things that we never really saw in the past, varicella, coming up in the upcoming year as a result of the vaccinations not being given.
Okay. Now, Ebony, I'd like to transition over to you because I kind of view you as one of our soldiers right in the field, in the thick of things, and you see it through a different lens, especially from a community engagement standpoint. And so what's your perspective on the flu shot and maybe the conversations you're having with the families that you interact with?
So my perspective is the same as Dr. Vasquez shared, the importance of it. So I see firsthand the distrust. So I'm the person that will get told during certain events that we are encouraging the flu vaccination, but not just the flu vaccination, but the education around it to build capacity and build health literacy in our community. So I'm getting all of the negative stories, or my grandma didn't take it, or I took it and I got sick. So I get that firsthand, but I'm still very firm and sure about what I'm communicating to them and the importance of doing so. That's, and I think at the time right now we're in with COVID, people are very afraid of COVID-19. So they are doing all of the precautionary measures that they can, but the flu they've grown comfortable with. Not being vaccinated, but it is more of an importance for them to do so this year. So from the frontline standpoint, I'm communicating and I do see the resistance, but I am continuing to push through with our efforts.
The truth of the matter is that this is going to take all of us coming together to understand that there are certain extremely important factors at work here. First and foremost, we need to dispel the myths around vaccinations, because we've used vaccinations at least for the last 100 years or so, and they have always proven to be extremely efficacious. There grew up in the last 30 or 40 years all of these myths around vaccinations. Why are people in our community, Black and Latinx, suddenly susceptible to hearing those myths? Well, basically, we are susceptible because our earliest contact with medicine in this American experience was with the physician who was appointed to examine the humans who were captured and brought here to be sold into bondage. And that first contact in this American experience has put an ingrained mistrust in medicine and its efficacy. And so we've got to do the work as African Americans, as Latinx, all to dismantle those myths.
We're going to take a very short break, so don't go anywhere. We have more exciting conversation on the other side of the break.
Western New York at Work is brought to you by our key business partners and many business professionals.
Bocce's Club Pizza, Staff Buffalo, Buffalo Healthy Living, CAI, Hope Buffalo, Embassy Suites, 716 Limousine.
We're all just trying to keep things running for those who rely on us. That's why we don't have time to be sick with the flu.
We don't have time for delays.
We don't have time for spills.
Next.
We don't have time for setbacks. Let's be real.
Getting the flu shot
Helps you fight the flu.
Get a flu shot for yourself and those around you too.
When I was 10, my mom got deported. We had a difficult time, and I feel that's why I didn't get to finish school. My husband is really supportive in a way that he pushed me to go back to school.
She wants to have a career so her kids can look up to her.
They both keep me motivated to go to school, and they see that if I do it, like, they can do it too, you know? I feel that everything's possible.
Find free adult education classes near you at finishyourdiploma.org.
3 months ago, there weren't enough masks. We were desperately sourcing from all over the world. People were making face coverings from scarves, bandanas, and bits of fabric. Now there are plenty of masks, but some people don't want to wear them. Come on. Mask up, America.
Welcome back to Western New York at Work. Now, speaking of that fear factor is really what I'm hearing. So Dr. Vazquez, I want to come back over you, and then Stan, I want to tap into you as well. What is your healthcare system saying to the patients that are just absolutely afraid to get a vaccination shot? They've never had it before. They feel that they're going to get sick as a result.
Well, you know, you try to kind of orient, explain it to people. I mean, our health system is more focused that if you say you don't want it, that's okay, refuse. So in our communities, you see refusals quite high because you don't really explain it to them the way they should have an explanation. I usually, especially for the flu shot, I'm more devil's advocate. I'll see an older person comes in with their grandkid, and all I basically said is that, I'm vaccinating you to protect you, but it's really to really make sure that your grandchild doesn't die over this. And I've had little girl traumatized, grandma, am I gonna die? And what they do after a while, give me that damn vaccine, So you've got to play to whatever you have to do to make sure they get it. But it's real important. It's really important to educate people. And I think it's so much easier, and I get angry when we're offering preventive services, and some of the people that even work for me will kind of go like, okay, they refuse. No, that you sit down and explain it at their level so that they understand what this is. I think, 90% of the time, if you have a good bond and connection with your patients, they listen to you. And I've been seeing people for the last 30 years. So it's been good, bad, and ugly in some cases, but everybody knows that it's the right thing to do.
I would say Dr. Vazquez, he's very kind right now, and a very humble guy. He and his staff has been instrumental in helping us to increase awareness and to educate, those with the greatest need in terms of why it's important to get the flu shot. As Pastor Pointer mentioned, there's a lot of historical trauma there. So we're very fortunate to have Dr. Vazquez, someone from the community, someone who's well respected, that's trusted to be a spokesperson and a champion, in terms of delivering key messages and willing to be on the front line and stand shoulder to shoulder with us. There are very few communities that have a Dr. Vazquez that are willing to, be giving of their time. So when the community sees someone that they're familiar with, that someone that, they can trust, as we mentioned earlier, that is critical in terms of why someone may or may not, be receptive to the information, meeting folks where they're at, and might require a little bit more points of information and contact or intersection that say, what, I'm not only going to protect myself, but I'm also going to protect my loved ones. I'm going to protect my community and get vaccinated.
Well, I'm glad you brought that up, because when I look at this panel, I see a true community collaboration / partnership. And I want to kind of do a deep dive into what initiatives we want to make sure our viewers are aware of, that this collaborative effort is making happen.
The 6th of December is the flu vaccination week. So that's where the influenza is supposed to be at one of its highest peak. So we've already started to get ahead of this curve. We started this initiative back in October. Number one, as I mentioned earlier, to increase awareness. Second of all, to educate, to dispel some of the myths that we've heard about thus far, to build those relationships, as well with clinical providers, as well as to do focus groups, community education, as well as messaging that comes from the community. In addition, that they have a choice, and meeting people where they're at is critical. So the next step for us now is to continue these conversations, listening means listening, and doing less talking to the community, as well as working with those individuals who are on the front line to implement a health intervention called the 3 A's. Real quickly, that means to ask them if they've gotten the shot. Depending upon on their response or not, you would then advise them that they should get the shot. If you can personalize it, you can ask, well, what are your fears or your concerns about not getting it? Then you can address those. And then last but not least, to act, to provide access to the vaccination, to increase more information. Today, you can get it at GBON, or you can get it at, one of the pharmacies, or, you can see, or go to your faith community. There's mobile clinics that we've been implementing that, we're removing barriers and building bridges. So you can expect to see those type of initiatives to continue, even into the new year. And
the medicine, physician, and the pastor, preacher is a natural alliance. I mean, because no one else professionally is with the person through the balance of their lives. The physician and the pastor are both present at birth and then all the way through life. So when we sought to work with Dr. Vazquez and the other safety net physicians in Buffalo, we knew that they already possessed the professional means to get into our congregations and share the information that will lead to better health outcomes. So this is a natural kind of expression for us. And then both of us are in this community. These are the people that we go to worship with. These are the people that we socialize with. These are the people that we care about because we see them in every stage of their lives. And so we work deliberately with projects like REACH and with community educators like Ebony Patterson-White, because it's just a natural expression of our concern for the rest of this community.
The goal? To reduce teen pregnancy rates by 30% by the year 2020. The Hope Buffalo Initiative is on a mission to make Buffalo a healthier place for teens, with a focus set on 9 zip code areas where disparity rates of teen pregnancies are almost 2.5 times the national rate.
One of our guiding principles entails us to really address the social determinants of health. Let's look at some of the root causes of poverty as opposed to looking at teen pregnancy as a root cause of poverty. And having said that, we've been able to partner with over 40 organizations from the Buffalo community to really help make this goal come true, make it a reality.
Welcome back to Western New York at Work. Okay, all right. Gentlemen and ladies, I want to take an opportunity to kind of change the tone just a little bit. What are we not discussing today that really needs to be put on the table? Because this is a big topic and you can't get it in all at one time, but there's certain things that we may not have addressed as of yet. And Ebony, I would like to start with you.
We've addressed much as it pertains to REACH, but really the connectivity of our community to primary care. I've spent much of my tenure trying to encourage the use of primary care. We can no longer live in our community without having a connectivity or relationship with the primary care for the maintenance of our ongoing healthcare needs. We know the data already shows that we have a host of comorbidities that are not being cared for. Emergency care is not going to do. it is not going to do. And what I look forward to doing is, as we, even though our initiative is about flu vaccination, shingles shots, I want to make sure that if you are not connected, we want to get you connected to clinical needs for ongoing. So you have all of the things that you need for preventive care. So it's just not a one-stop shop. It's just not one thing. We want to make sure we are taking care of ourselves, taking care of our communities. So I think that's the overall, and we just took a snippet out of it that we're focusing on the flu shot and all of those other things, but it's overall health, taking care of ourselves.
Multiple vaccinations are good, and not just if you're a child. If you're an adult and you're not vaccinated right now against the flu, against pneumonia, and if you had chickenpox as a child, you should also be vaccinated against shingles. Look, and so what we should be saying to people is, look, it's a momentary discomfort. Take the doggone shot. And let's protect not just you, but everybody around you, because that's what taking the shot will do.
Yeah, that's it. I mean, we eradicated smallpox, and it was a very bad disease all through vaccination. So I think the more we orient and tell people about vaccinations, they're crucial. I think we do a terrible job with vaccinations in terms of, so because I see the data in hospitals where, they're focused on taking care of people, but really not doing the vaccination component, even though the state, in certain markets are giving the vaccinations for free. People are just not there. We're not there. The schools, the disconnect. We don't have systems that are tracking it as well. So there's a lot of problems that occur right now. I think a grassroots approach to what we're doing now in these medical neighborhoods are important. So just not, the flu is one thing, but COVID vaccine, we haven't even opened up that door. And that's going to be a real major problem. And what distribution systems are you going to be able to do that? Now, the health department, they weren't equipped for contact tracing. They weren't equipped for testing. They weren't equipped for all this other stuff. And what I said, Reverend, as you know, has happened. Now the tests are coming back late. The contact, they don't have communication systems that are conducive to what medicine is today. It's got to be mobile. You got to be in the community. You got to have telesystems. If you wait to let hospitals and the Department of Health kind of take place, we're going to be in where we are right now. That we'll be in the red by next week. Now the cases are going to be hospital and deaths, and unfortunately, we're the ones that are going to be kind of suffering from that. And so we just have to have a better system so that the community can really react and take care of itself.
And for any of our viewers that are just now joining in, they've heard a great bit of information, and I know that they're looking for that one call to action.
They can call our office at 882-0366. And we have our websites, urbanfamilypractice.com. The problem we have is the next 4 to 6 weeks, while we want to do this, it's going to be a really bad time. It's a mutated virus. It's going to do worse than it did in the beginning. And we have the 20 to 40-year-olds that are going to be hit. And this almost resembles, to the T, the Spanish flu, 1918. If you look at it, you'll see exactly what we're going through. So while you want to have events to do stuff, it's going to be really, really difficult. So Thanksgiving, it's a COVID Thanksgiving, COVID Christmas, COVID New Year's. Vaccines will probably be more available to us in the second quarter of 2021. I want people locked down for the next 4 to 6 weeks. I don't want to be out there during a red zone, try to bring people together to vaccinate. That's not going to be what we want to do. So we have a short window.
Stan, I'm going to transition over to you. Earlier in the conversation, you mentioned you have a choice. You said fight the flu and protect yourself and protect your family. Can you echo those words and that message once again? Because I think it's so important that our viewers hear that more than just once during today's broadcast.
Yes, I think it's important for people to know that when they're meeting with their physician or they're meeting with their pastor or healthcare provider, that they have a choice. Certainly, it's our job to educate and provide you with information to make an informed decision. And ultimately, at the end of the day, it's your choice. One of the things that motivates people sometimes to make that choice is having empathy, empathy for others, their loved ones, their parents. Della and I, our mother, she's, senior, and, we don't want to, visit her and, infect her, with, COVID or the flu, influenza. So, caring about other people for your other, your fellow man, is important. In addition, that message may resonate with folks. And in addition, doing your research. There's a lot of myths that we've already talked about, and sometimes doing your research together. And these are all messages that Ebony and I heard from the community that we want to encourage, people to do, as they're making a decision. But also we want folks to make an informed decision. And one of the things I would say, Dale, not to overwhelm, Dr. V and his staff, if people, wanted to find out more information where they can go or, to get the vaccine, they can, while they're sheltering in place, they can visit getmyflushot.org. It's a website that they can go to and they can find out information as well that's in their close proximity, to obtain, more information about the vaccine or access to it. What we're all doing, Dale, something that you mentioned earlier that we haven't touched about, is that place matters. Where you live matters. Your zip code level matters. Your zip code area matters. And as we know in this field, it should not be a death sentence. It should be a lifeline. So therefore, what we're also doing is not only recognizing that change has to take place at the individual level, the environment, the built environment itself has to change. So therefore, we all have agreed to come together collaboratively, and others who aren't here, to make sure that we're taking a strength-based approach so that everyone have access to the services and resources that he or she or they need, so that they can live a better quality of life.
Fantastic. I love it. Is at this time of the show that we go to parting thoughts. Ebony, any parting thoughts?
Do it for yourself, do it for your family, and do it for your community. So that is why you need to take care of yourself.
And look, in a few months, when the COVID vaccination comes, let's do the same thing. Get it for yourself, get it for your family, get it for your community.
I think the message is clear. You guys are standing shoulder to shoulder in unity and your collaboration. And let's make sure that the community is aware of what to do, what not to do, and where to go do it. And and we can address the 9 zip code area in the city of Buffalo that need it the most. I think that's a great place to start. Stan, thank you so much for assembling this great panel discussion. I think it's something that we need to do again. It's not a one-time, one-shot only in terms of conversation. Thank you so much to all of you for being a part of Western New York at Work.
Thank you for having us, Dale.
Thank you. Thank you, everyone.